Here are some examples of what clinicians are seeing when using the Stericam. For the first time, they are discovering that a large percentage of devices that were previously approved as being dually reprocessed and therefore safe for patient use are in fact far from safe, and these devices could represent an immediate hazard to patient safety. This is the inside of an arthroscopic shaver handpiece. This is what it's supposed to look like. The second is the inside of the working channel of a GI scope. Again, this is what it's supposed to look like. Now this is what they often look like. The first image is an arthroscopic shaver handpiece used in an ambulatory surgery center in Southern California. These images were taken to the board of directors of that facility. The devices were immediately replaced. The second image shows fluid retained inside the working channel of a GI scope. The fluid is not supposed to be there if a facility follows the protocols for reprocessing, and they had followed those protocols. Steriview exposed the flaws in their process. This video is the inside of a colonoscope's instrument channel after cleaning. We're at the upper end of the channel, working our way down towards the tip of the scope. You can see a few scratches and multiple areas of staining. This channel is supposed to be dark at the very top, which is a steel structure, transitioning to an eggshell white color with no stains whatsoever. Clearly the scope is deficient. It's not patient ready. Next is a gastroscope that's been brushed and cleaned with detergent, but not yet gone through the final automated endoscope pre-processing stage. You can see they're deep and badly stained, which is unexpected. Further down you see longitudinal scratches, likely due to biopsy. This is a concern. Since these images are new to clinicians, when seen for the first time, the immediate fear is that the stains represent a potential source of contamination that could infect the next patient. This is a colonoscope channel with a bright red stain at the proximal end. Nobody knew what this was when it was seen, so the scope was removed from service. We learned later the repair vendor marked the channel with a red ink finish, which was supposedly physiologically inert. Further down the channel, you see an excellent example of retained fluids inside the channel, which again is supposed to be completely dry. We see this a lot. Nobody knows what's in that fluid, which is often there days after the scope has been reprocessed. In this case, it was 3 days after. Very concerning. This is an arthroscopy shaver handpiece. The handpiece is cleaned and sterilized between cases. As we pass the inspection scope into the suction attachment, you see corrosion, and then you see this irregular machine surface of the inner wall, and you see bits of linen fiber. As we move forward, sometimes we see bone chips, blood tissue, and foreign objects such as metal shavings. More corrosion as well. And as we go all the way down the bore, we get to the valve assembly, and you'll be able to see it open and close inside. This is often rusted and corroded, and it's very, very difficult to clean properly. As it opens, you'll see our inspection scope go right up inside the valve itself, and you can see the scratching that's there. So as you can see, these complex instruments can harbor a range of anomalies, all of which are impossible to detect without an inspection scope. Here are 2 studies that were published using the Steriview system as the inspection device. ECRI Institute ranks dirty and damaged surgical instruments among the top 3 health technology hazards year after year. Unclean instruments have transferred virulent pathogens, and they continue to infect unsuspecting patients. Steriview offers a solution to this escalating and incessant hazard.